Hello everyone, now let us discuss about 2023 CPT coding guidelines for surgery musculoskeletal system part 10. In the current session, we will be discussing about the leg and the CPT range is 276,002 27899. Now coming to leg, which includes tibia and fibula and also ankle joint. They are again categorized into the leg and ankle joint are categorized into incision, excision, introduction or removal, repair, revision and or reconstruction, fracture and or dislocation, manipulation, arthrodesis, amputation and finally other procedures. The CPTs for incision is CPT range is 276,002 27612 and for excision they are 27613 to 27647 and for introduction or removal the CPT range is 27648. There is only one CPT, that is 27648. Coming to repair, revision and or reconstruction, the CPT range is 27650 to 27745. And for fracture and or dislocation, the CPT range is 27750 27848. And for manipulation, the CPT is 27860. And for arthrodesis, the CPT range is 27870 to 27871. And for amputation, the CPT range is 27880 to 27889. And finally, coming to other procedures, they come under 27892 to 27899. First of all, coming to incision, the first CPT is 27600. It deals with decompression fasciotomy, leg, anterior and or lateral compartments only. If it is only posterior compartment, the CPT is 27601. And for anterior and or lateral and posterior compartment, the CPT is 27602. And for incision and drainage procedures superficial, you need to refer 100402 10160. And for decompression fasciotomy with debridement, the CPT range is 27892 to 27894. The next CPT is 27603. It deals with incision and drainage, leg or ankle, deep abscess or hematoma. The next is IND, incision and drainage of infected bursa. 27604 deals with incision and drainage of infected bursa. The next CPT is 27605. It deals with tenotomy, percutaneous Achilles tendon, local anesthesia, with local anesthesia. If tenotomy, percutaneous Achilles tendon requires general anesthesia, then the CPT is 27606. The next is 27607. It deals with incision, for example, to treat osteomyelitis or bone abscess, leg or ankle. The next CPT is 27610. It deals with orthotomy, ankle, including exploration, drainage or removal of foreign body. The next is 27612. It deals with orthotomy, posterior capsular release, ankle with or without Achilles tendon lengthening. And for further understanding, you need to refer one more CPT 27685. Now let us see an example. Patient presents with deep abscess of ankle. IND was performed. IND is nothing but incision and drainage. Here the CPT is 27603. Incision and drainage, leg or ankle, deep abscess or hematoma. Now coming to excision CPTs, the first CPT is 27613. It deals with biopsy, soft tissue of leg or ankle area, superficial. The next CPT is 27614. It deals with biopsy, soft tissue of leg or ankle, deep, which includes subfacial or intramuscular. And for needle biopsy of soft tissue, use 20206. The next CPT is 27615. It deals with radical resection of tumor. For example, sarcoma, soft tissue of leg or ankle area less than 5 centimeters. If it is 5 centimeters or greater, the CPT is 27616. And for radical resection of tumor of cutaneous origin, for example, melanoma, We need to see 11600 to 11606. The next CPT is 27618. It deals with excision, tumor, soft tissue of leg or ankle, subcutaneous, less than 3 centimeters. If the tumor size is 3 centimeters or greater, then the CPT is 27632. This is a out of numerical sequence CPT because after 618 we are getting 27632. The next CPT is 27619. It deals with excision, tumor, soft tissue of leg or ankle area, subfacial, less than 5 centimeters. If the tumor size is 5 centimeters or greater, then the CPT is 27634. This is also out of numerical sequence. The next CPT is 27620. It deals with orthotomy, ankle with joint exploration, with or without biopsy, with or without removal of loose or foreign body. The next CPT is 27625. It deals with orthotomy with synovectomy ankle. The next is 27626. It deals with orthotomy with synovectomy including tenosynovectomy. The next CPT is 27630. It deals with excision of lesion of tendon sheet or capsule, for example, to treat cyst or ganglion, leg or ankle area. The next is 27635. It deals with excision or curettage of bone cyst or benign tumor, tibia or fibula. If it is done with autograft, then the CPT is 27637. If it is done with allograft, the CPT is 27638. The next CPT is 27640. It deals with partial excision, bone, tibia. The next CPT is 27641. Partial excision, bone, fibula. The next is 27645. It deals with radical resection of tumor, tibia. And for radical resection of tumor, fibula, the CPT is 27646. And for the radical resection of tumor, talus or calcaneus, the CPT is 27647. Next, coming to introduction or removal, there is only one CPT, 27648. Injection procedure for ankle arthrography. And for radiological supervision and interpretation, use 63615. And do not report 77002 in conjunction with 63615. And for ankle arthrography, see 29894 to 29898. Next, coming to repair, revision and or reconstruction. The first CPT is 27650. It deals with repair primary, open or percutaneous ruptured Achilles tendon. If the repair of Achilles tendon, primary repair of Achilles tendon, if it is done with the graft, then the CPT is 27652. The next CPT is 27654. It deals with repair secondary. Previously it is primary. Now 27654 deals with repair secondary Achilles tendon with or without graft. The next CPT is 27656. Repair facial defect of leg. The next is 27658. It deals with repair flexor tendon leg primary without graft each tendon. The next CPT is 27659. It deals with repair flexor tendon leg secondary with or without graft each tendon. The next CPT is 27664. It deals with repair extensor tendon leg primary without graft each tendon. Next is 27665. Repair extensor tendon. Previously it is repair flexor tendon. Now it is extensor tendon secondary with or without graft each tendon. The next is 27675. It is repair dislocating peroneal tendons without fibular osteotomy. The next is 27676. It deals with repair dislocating peroneal tendons with the fibular osteotomy. The next CPT is 27680. It deals with tenolysis flexor or extensor tendon, leg and or ankle, single, each tendon. The next is 27681. Tenolysis, flexor or extensor tendon, multiple tendons through separate incisions. The next CPT is 27685. It deals with lengthening or shortening of tendon, leg or ankle, single tendon. And for lengthening or shortening of multiple tendons through same incision. Lengthening and or shortening of tendons through same incision each, then the CPT is for multiple tendons 27686. The next CPT is 27687. It deals with gastrocnemius precision, that is Strayer's procedure. Toe extensors are considered as a group to be a single tendon when transplanted into midfoot. When you are coding this procedure, you have to keep in mind that toe extensors are considered as a group to be a single tendon when transplanted into midfoot. The next CPT is 27690. It deals with transfer or transplant of single tendon with muscle redirection or rerouting, superficial. For example, anterior tibial extensors into midfoot. The next CPT is 27691. Transfer or transport of single tendon deep. For example, anterior tibial or posterior tibial through interosseous space, flexor digitorum longus, flexor hallucis longus, or peritoneal tendon to midfoot or hindfoot. And for each additional tendon thereafter to be reported for the primary along with the primary procedure, the add-on CPT is plus 27692 and use 27692 in conjunction with either 27690 or 691. The next CPT is 27695. It deals with repair primary disruptured ligament ankle collateral. The next is 27696. Repair primary disruptured ligament ankle both collateral ligaments. The next is 27698. It deals with repair secondary. Previously it is primary, now it is secondary disruptured ligament ankle collateral. For example, Watson-Jones procedure. The next CPT is 27700. It deals with orthoplasty ankle. If orthoplasty is performed with implant total ankle, the CPT is 27702. And orthoplasty ankle revision total ankle, the CPT is 27703. And for removal of ankle implant, the CPT is 27704. And for osteotomy tibia, the CPT is 27705. And for osteotomy fibula, the CPT is 27707. And for osteotomy tibia and fibula, the CPT is 27709. And osteotomy multiple with realignment on intramedullary rod. For example, Sofield type procedure, the CPT is 27712. And for osteotomy to correct genovirus, that is bowleg, or genovalgus, that is knock knee, C 27455 to 27457. The next CPT is 27715. It deals with osteoplasty, tibia and fibula, lengthening or shortening. The next CPT is 27720. It deals with repair of non-union or malunion tibia without graft, for example by compression technique. And if it is done with sliding graft, the CPT is 27722. And if it is done with iliac or other autograft, then the CPT is 27724. And if it is done by synostosis, if it is done by synostosis with fibula, any method, the CPT is 27725. The next CPT is 27726. It deals with repair of fibula, non-union and or malunion with internal fixation. And do not report 27726 in conjunction with 27707. The next CPT is 27727. It deals with repair of congenital pseudoarthrosis tibia. The next CPT is 27730. It deals with arrest epiphyseal open distal tibia. And if it is distal fibula, the CPT is 27732. And if it is distal tibia or fibula, the CPT is 27734. The next CPT is 27740. Arrest epiphyseal, any method combined proximal and distal tibia and fibula. And for the arrest of epiphyseal, any method distal femur. If it is proximal and distal tibia and fibula and distal femur, then the CPT is 27742. And for epiphyseal arrest of proximal tibia and fibula, you need to refer 27477. The next CPT is 27745. Prophylactic treatment. For example, nailing, pinning, plating or wiring with or without methyl methacrylate tibia. Now let us see an example. A 47-year-old patient was previously treated with external fixation for type 3A left lateral condyle tibial fracture. There is now non-union of the left proximal tibia and he is admitted for open reduction of tibia. Previously it was treated and now it is non-union. And the patient is admitted for open reduction of tibia with bone grafting. And approximately 30 grams of calcareous bone was harvested from the iliac crest. Graft is obtained from iliac. And the fracture site was exposed and the area of non-union was osteomatized and cleaned and repositioned. Interfragmentary compression was applied with 3 screws. So here the CPT is 27724. Repair of non-union or malunion tibia with iliac or other autograft. Now coming to fracture and or dislocation codes. The first CPT is 27750. It deals with closed treatment of tibial shaft fracture with or without fibular fracture without manipulation. And if it is done with manipulation, that is closed treatment of tibial shaft fracture with manipulation with or without skeletal traction. The next CPT is 27756. It deals with percutaneous skeletal fixation of tibial shaft fracture with or without fibular fracture. For example, pins or screws. The next CPT is 27758. It deals with open treatment of tibial shaft fracture. Open treatment of tibial shaft fracture with or without fibular fracture with plates or screws with or without circlage. The next CPT is 27759. Treatment of tibial shaft fracture with or without fibular fracture by intermedullary implant with or without interlocking screws and or circlage. The next CPT is 27760. It deals with closed treatment of medial malleus fracture without manipulation. The next is 27762. It deals with closed treatment of medial malleus fracture with manipulation with or without skin or skeletal traction. The next CPT is 27760. It deals with open treatment of medial malleus fracture. Open treatment of medial malleus fracture includes internal fixation when performed. The next CPT is 27767. It deals with closed treatment of posterior malleus fracture without manipulation. The next is 27768. It deals with closed treatment of posterior malleolus fracture with manipulation. The next CPT is 27769. It deals with open treatment of posterior malleolus fracture includes internal fixation when performed, and do not report 27767 and 27769 in conjunction with 278082 27823. The next CPT is 27780. Closed treatment of proximal fibula or shaft fracture without manipulation. And if it is done with manipulation, the CPT is 27781. The next CPT is 27784. It deals with open treatment of proximal fibula or shaft fracture. It includes internal fixation when performed. The next is 27786. It deals with closed treatment of digital fibular fracture, that is lateral malleolus, without manipulation. If it is done with manipulation, the CPT is 27788. The next CPT is 27792. Open treatment of distal fibular fracture, lateral malleolus, includes internal fixation when performed. And for treatment of tibia or fibula shaft fracture, C 27750 to 27759. The next CPT is 27788. It deals with closed treatment of bimalleolar ankle fracture, lateral and medial malleoli, or lateral and posterior malleoli, or medial and posterior malleoli. It can be any type. Bimalleolar ankle fracture without manipulation. And for closed treatment of bimalleolar ankle fracture with manipulation, the CPT is 27810. The next CPT is 27814. It deals with open treatment of bimalleolar ankle fracture. Open treatment of bimalleolar ankle fracture, for example, lateral and medial malleoli, or lateral and posterior malleoli, or medial and posterior malleoli. It includes internal fixation when performed. The next CPT is 27816. It deals with closed treatment of trimalleolar ankle fracture without manipulation. And for the closed treatment of trimalleolar ankle fracture with manipulation, the CPT is 27818. The next CPT is 27822. It deals with open treatment of trimalleolar ankle fracture, includes internal fixation when performed, medial and or lateral malleolus without fixation of posterior lip. And if it is done with the fixation of posterior lip, the CPT is 27823. The next CPT is 27824. Closed treatment of fracture of weight bearing articular portion of distal tibia. For example, pilon or tibial plafond, with or without anesthesia, without manipulation. If it is done with the skeletal traction and or requiring manipulation, then the CPT is 27825. The next CPT is 27826. It deals with open treatment of fracture of weight bearing articular portion of distal tibia. Open treatment of fracture of weight bearing articular portion of distal tibia. For example, pilon or tibial plafond, with internal fixation when performed of fibula only. And if it is performed for tibia only, the CPT is 27827. If it is performed for both tibia and fibula, the CPT is 27828. The next CPT is 27829. It deals with open treatment of distal tibiofibular joint syndesmosis disruption, includes internal fixation when performed. The next is 27830. It deals with closed treatment of proximal. Previously it is distal, now it is proximal tibiofibular joint dislocation without anesthesia. If it is requiring anesthesia, then the CPT is 27831. The next CPT is 27832. It deals with open treatment of proximal tibiofibular joint dislocation. It includes internal fixation when performed or with excision of proximal fibula. The next CPT is 27840. It deals with closed treatment of ankle dislocation without anesthesia. If closed treatment of ankle dislocation is performed with anesthesia, with or without percutaneous skeletal fixation, then the CPT is 27842. The next CPT is 27846. It deals with open treatment of ankle dislocation with or without percutaneous skeletal fixation, without repair of internal fixation. Without repair or internal fixation. And if it is done with repair or internal or external fixation, then the CPT is 27848. And for surgical or diagnostic orthoscopic procedures, you need to refer 298942, 29898. Now let us see an example. A 45-year-old patient presents for a closed treatment of left malleolar ankle fracture. Here they did not mention whether it is manipulation, with manipulation or without manipulation. So by default you have to take without manipulation. The CPT is 27816 along with LT modifier to indicate the left side. 27816 is nothing but closed treatment of trimalleolar ankle fracture without manipulation. Next, coming to manipulation, there is only one CPT under manipulation, that is 27860. It deals with manipulation of ankle under general anesthesia. It includes the application of traction or other fixation apparatus. The next is orthodesis. This first CPT is 27870. It deals with orthodesis ankle open, and for orthoscopic ankle orthodesis use 29899. The next CPT is 27871. It deals with orthodesis tibia fibular joint, proximal or distal. Next, coming to amputation. The first CPT is 27880. It deals with amputation leg through tibia and fibula. If amputation leg with the immediate fitting technique including application of first cast, the CPT is 27881. And if the amputation of leg it is open or circular, then the CPT is 27882. If it is for secondary closure or scar revision, amputation leg, secondary closure or scar revision, the CPT is 27884. And for reamputation, the CPT is 27886. The next CPT is 27888. It deals with amputation ankle through malleoli of tibia and fibula. For example, sign or pyrogoph type procedures with the plastic closure and resection of nerves. And finally 27889. It deals with ankle disarticulation. The CPT for ankle disarticulation is 27889. Next, coming to other procedures, that is the final topic. 27892 is the first CPT. It deals with decompression fasciotomy leg, anterior and or lateral compartments only with the debridement of non-viable muscle or nerve. And for decompression fasciotomy of leg without debridement, you need to use 27600. The next is 27890. It deals with decompression fasciotomy leg posterior compartment only with the debridement of non-viable muscle and or nerve. And for decompression of fasciotomy of leg without debridement, the CPT is 27601. The next CPT is 27894. It deals with decompression fasciotomy leg, anterior and or lateral and posterior compartments with the debridement of non-viable muscle and or nerve. And for decompression fasciotomy of leg without debridement, you need to use 27602. And finally coming to unlisted procedure, 27899. It deals with unlisted procedure, leg or ankle. By this we complete leg and ankle joint. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.